I wanted to talk firstly about Doctor Higgins in your neck of the woods, Catherine. He seemed to say that he was getting over his symptoms, that he came from the United States, that he didn't need to test for the coronavirus. It's not part of the rules or regulations. Neither is it right now, I might add. But the point I was trying to make to the AMA president was the fact that here we had a situation where he had come from the United States at a time when they lost someone, at a time when the WHO had elevated the alert more than at any other time during this crisis, and maybe he should have known that a test would have been precautionary and the best way to go. What are your thoughts, Catherine?
I'm totally the same, Chris. You would have to be living under a rock not to actually know that the coronavirus is a problem. It's been all over the news for a very long time. And you would think as a general practitioner that you would actually take the precautions, knowing that he actually went out and treated elderly patients, the vulnerable. You would take those precautions. I think the Health Minister here in Victoria did the right thing and called his behaviour out.
Yeah, Tim, she said she was flabbergasted by it. It was February 29, though, and we've moved on a little bit since then, but having said all of that, I'm not convinced as to why the doctor risked anything and saw 70 patients.
Yeah, it's a bit of a surprise there. I mean...
Go on, Tim.
Yeah, look, I think it's a bit of a surprise there. My daughter had the flu last week and we booked her in to see the doctor, and she couldn't go down there until the surgery was cleared almost after hours, even though she only had a mild case of the flu that she picked up at school. So those are the precautions that are being taken with everyday members of the public. I think as a doctor, even though perhaps the criteria weren't exactly having to be fulfilled, the wisest course of action would have been to test yourself. It's been in the public gaze. People do know it's a concern. Test yourself and then you can be sure one way or the other. I think that would have been the prudent thing to do. Having said that, I don't necessarily believe that he needs to be embarrassed or called out for it. It's an entirely human reaction.
Yeah.
And you know, I think we've got to treat people decently, and doctors who are out trying to do their best, trying to do the right thing by people. He made an assessment. It was obviously he got it wrong, but prudence would have said, get yourself tested. You would have been in a far safer position.
Yeah, I would have thought so. But as you say, he doesn't need to be lambasted for it, and I don't think the Minister needs to apologise either. Catherine, just looking at what's happening with the cruise ship, I thought the way the Japanese handled the Diamond Princess when it was docked off Hokkaido, I thought it was appalling that every single passenger wasn't tested. We had this silly idea where every day another 10 people would get infected. We'd take them off the ship. Everyone else stayed together on the ship. Whereas this time, off the coast of California, the Grand Princess and that's 3,500 passengers, they're all getting tested. I get the feeling that we've learnt from the first debacle. Do you?
I do too, Chris. I would believe that it makes most sense to actually test everybody on board, and to see that there was majority of the crew that were infected, it makes total sense to actually quarantine them, make sure that everybody's safe, and test everybody.
Yeah. Get it done, and get it done at the start so you can work out what the plan is.
Do it right the first time.
Yeah, exactly. Tim, how do you think the Australian government is handling this crisis at the moment?
Oh, look, Chris, I think they're doing a pretty good job. They got ahead of the World Health Organisation in their declarations. They've been on the front foot in terms of keeping the public advised. They've managed to obviously deal with the quarantine situation. The recent declarations in relation to South Korea, as tough as it is, because South Korea are our friends and great trading partners, are necessary. I think they've been generally pretty good on it. Last Friday, the Prime Minister obviously announced up to $1 billion for the costs of treating the coronavirus to be shared amongst the states. That's a 50-50 split, so that's a very generous offer. I mean, I think we can't play politics with this. I think we've got to get on the front foot for it. And I think the government has been pretty much on the ball in doing that and making sure the people who are out there worried about it, genuinely worried about it, are getting the information they need.